Raju for having given me this opportunity to moderate this CKD-MBD symposium. And as we know all, the time is very short. So before I introduce all the speakers, let me give a brief introduction of this topic. The topic is CKD-MBD, what has changed? In fact, I would suggest what has not yet changed. Everything has changed. Say for example, the terminology in 1883, when Lucas have observed the finding skeletal abnormalities in CKD patients, he has used the term renal rickets. Subsequently, this terminology was interchangeably used as renal osteodystrophy. And very recently, the current terminology CKD-MBD was given by this working group of KDIGO. The second thing, definition. So if you take the classical definition of CKD-MBD or rickets or ROD, it was limited to the renal failure with bone abnormalities or skeletal abnormalities. But if you take the current KDIGO definition, it has three components. It defines as a systemic disorder which consists of mineral metabolism abnormalities, and bone abnormalities, and tissue and vascular calcification. This is the current definition as defined by KDIGO working group. And pathogenesis, I believe the speaker will elaborate more. If you take the classical hypothesis, it's a trade-off hypothesis. Renal failure leads to hyperphosphatemia, which ends up in hypocalcemia, which activates secondary hyperparathyroidism. This is the old classical theory. Now, after the discovery of FGF23 and Klotho, the pathogenesis has modified to a greater extent. And regarding biomarkers, we all know the most important biomarkers in CKD-MBD is alkaline phosphatase, acid phosphatase, and PTH and so on. And in the recent days, we have newer biomarkers, and Dr. Jyoti Priya will highlight on all of us on these biomarkers, newer biomarkers, and their recognition and their importance in making diagnosis and monitoring of CKD-MBD. And regarding medical management, Dr. Pramod, he is going to highlight on medical management. As we all know, in the early period, these calcium-based phosphate binders were increasingly used, but the problem, as we all know, the most important side effect is hypercalcemia associated with calcium-based phosphate binders. Subsequently, the sevelamer, lanthanum, and bisphosphonates were introduced in the management of CKD-MBD. And after the introduction, after the new hypothesis of the role of FGF23 and Klotho, the newer therapies have emerged in the recent past. I would say still it is under experimental therapy like denosumab and Klotho gene therapy. So these are all some newer aspects of medical management which the speaker is going to highlight. So the last speaker would be Dr. Priya John. She will be highlighting us on what are the surgical challenges which we face with the management of secondary hyperparathyroidism. With this brief introduction, I invite the first speaker, Dr. Prabhakar, to highlight on pathogenesis of secondary hyperparathyroidism. Thank you.